By utilizing existing medical equipment, personnel, and facilities within both the Run Hospital and Nauru Public Health, Global Mission Support Services, GMSS, DMCC, delivers support aimed at reinforcing a more sustainable and resilient healthcare system in Nauru in the 10 years contract.
We got invited by His Excellency President David Adang and the Honorable Ministers of Health, and they kind of wanted to revamp and transform the entire healthcare system in Nauru, just because Dave saw a vision that this country needs a transformative healthcare system put in place to better serve the Nauruan people. And our role here is to support the current infrastructure that's in place and to build it to a higher level of care that's already in place. Our collaboration, and I can't speak enough of the current collaboration we're working with the local staff, have been nothing but welcoming and grateful that we're part of the team and we're not here to kind of separate the two entities. They've welcomed us, they've consulted with us, we've been part of the team from day one. We've been able to manage cases with them, whether it's acute medical problems, chronic medical problems, public health initiatives, protocols. They've really welcomed us with open arms in terms of changing the current healthcare infrastructure.
A contingent of highly qualified medical experts from the Central Disease Control is scheduled to arrive in Nauru to provide strategic support to the national healthcare system, contributing to the delivery of high-quality medical services for the Nauruan population.
We have a lot of projects concerning high standards healthcare in Nauru, and we invite a large scale of experts from the CDC, Center Disease Control in US, to support Nauru healthcare system, to provide guidelines, protocols, provide training, and also provide meeting concerning triage patients, to divide the flow of patients. And right now we already have a preliminary concept how to improve infrastructure in hospital and public health to make sure that Nauru people have the best health and best standards for everybody.
Critical areas within the healthcare system have undergone urgent and targeted improvements to strengthen the delivery of immediate, high-level medical care.
I believe Nauruans will feel changes, and near is time for now. First 3 months, it's like a transition period, and right now we have an operation need that we try to fix urgent needs. But right now we are in hiring process for high-level specialists who will be there on the rotation base, and I believe every ward in Nauruan hospital will increase level and standards of healthcare.
We've been able to bring in anesthesiologists and intensivists to manage some of the higher level of care that wasn't available previous to our arrival. One of the other areas is that we were able now to bring in subject matter experts in different specialties to review the OMR cases, pending OMR cases. We've also been able to kind of liaison between the public health sector and Ron Hospital to create initiatives and protocols for the current dengue outbreak. We've been able to invite and collaborate with the Center for Disease Control, who will be sending a technical officer within a couple of days to create a long-term dengue or even other sorts of outbreaks for the island. That way there's sustainability and resilience in place.
In alignment with the Government of Nauru's vision, Global Mission Support Services, GMSS, DMCC, continues to strengthen the national healthcare system by collaborating closely with local medical personnel and actively engaging communities to facilitate a smooth and transformative transition.
Current role here is to become medical advisors for the Nauruan government, and we were invited specifically by His Excellency President David Adang and the Honorable Ministers Charmaine Scotty, as well as Minister Maverick Ayui, and it's their vision that we're here to implement the changes that are needed for every single Nauruan and to work with the community, with the current healthcare infrastructure to be able to make a transformative change for the entire island and become a regional center of excellence. This is transformational because the idea of having an entire government be supportive and give full authority to an entire external company to come in and make changes immediately, but also create a sustainable future where it's not a couple of weeks or months, it's a 10-year project, which means the changes we're making are going to build a resilient healthcare system where the Nauruan people will be able to maintain those ideas, those changes for long-term care and generational changes to come in the future.
First time in the world this model was tried, and Nauruans and the First Nation in the world to have a vision to build it, and this is a shared journey for every nurse, every doctors, every member of community. And we would like to be part of this help, and we will work hand in hand on this project, and we're really proud to be there, and together I believe we can build future healthcare system which serve to Nauruan people the long years.